Hello there, and many thanks for joining us for yet another informative and interactive edition of the People's Parliament. We are coming to you live from the Kabale District Headquarters, where we intend to explore the role of the policymakers and other educators in the promotion of sexuality education and other sexual reproductive health and rights, respectively. Of course, my name is Romeo Busiku, and we have a host of speakers, including the District Health Officer, the Chief Administrative Officer, the District Community Development Officer, and also religious leaders, members of the public, the teenagers who have been affected so much during this COVID-19 pandemic. Well, the COVID-19 pandemic has exacerbated the vulnerability of the young people in this country. According to a police crime report that was authored in July, it actually indicates that 4,442 young girls have actually been defiled during this COVID-19 pandemic. And according to some literature that I was reading, that number has increased. The number of defiled girls has increased to 66,000. Yes, that's how callous the situation is. Now, when you look at the United Nations Education, Scientific and Culture Organization report, it states that Uganda has the highest number of school dropouts in the whole East African region. But then when you look at Uganda at home here, that number is kept at 42.9%. That's the number of girls dropping out of school every year. Those are some of the callous developments that are coming in, and that's why we are here to engage members of the public so that we can come up with some recommendations on how best we can disseminate sexual reproductive health and rights information in that regard for the adolescents in this country that make up 77% of the population. So you have majority of the population that is being disregarded by the central government simply because the keen focus is on avoiding the contraction and the spread of COVID-19. What about the young girls? What about the adolescent health, sexual reproductive health, and so forth? So that's why we are here. And allow me to call upon the national coordinator right here to give us a brief aggregation of the numbers as far as this conversation is concerned. Mr. Robert Ochaya, please take over the podium.
The Speaker of the People's Parliament, the honorable members of Parliament here present in Kabale, I welcome you to this very important debate today as we talk about our young people. As I was already introduced, my name is Robert Ochaya, the National Coordinator right here, right now, Uganda platform. And right here, right now, Uganda is a program that is being headed by Reproductive Health Uganda, that you all know. Reproductive Health Uganda is very interested on matters to do with the sexual reproductive health and rights of young people. And particularly, Reproductive Health Uganda is known about family planning, provision of family planning to our communities, such that we have children that we need and children that we want and children that we've planned for, as opposed to having children by chance. Right here, right now, Uganda platform is a program that is working with the government of Uganda and different stakeholders to ensure that we have policies that help service providers when they are addressing the sexual reproductive health of our young people. You might be aware that we've had policies such as the school health policy in Uganda, but this policy has been stale. That means it has not been reviewed for quite a number of years. And as you know, sexual reproductive health and rights are issues that evolve with time. We also have issues around sexuality education. Sexuality education has been banned in all Ugandan schools since 2016. And this was because of a number of issues that sometimes we don't agree about. And so our focus is to work with government of Uganda from the highest level to the district level to ensure that sexuality education is reintroduced into our schools. When we talk about sexuality education, it looks like something that is alien, but we are talking about informing our children about growing up, about bodily changes, about, what these bodily changes bring and how they should cope in terms of handling these bodily changes as they grow up. Why is sexuality education needed in Ugandan schools? We have seen a lot of negative indicators. We've seen teenage pregnancy rates as high as at 25%. 25% of our young girls becoming, pregnant when they are not ready to handle these pregnancies. How do we prevent this if we don't talk to them about growing up and about handling some of these challenges, we will continue to have these negative indicators. We've seen, girls dropping out of school as a result of these unintended pregnancies. We need to prevent this. We've also seen some of the girls misguided and, seeking abortion and end up, having complications which sometimes result into loss of lives, and sometimes, complications that are irreversible. We think that this should be prevented, such that we have our young girls stay in school, our young boys do not get children that they cannot, look after. We think that this can be prevented when we talk to our children, when we offer sexuality education in our schools, when parents play their roles in offering, this kind of information, when teachers in schools are allowed to provide this information. What we need to discuss today is that what do we need to do to address this issue?
Is it the government to blame or the parents? Because we saw the ban of sexuality education in 2016. Don't you think it's the reason why we are seeing high levels of teenage pregnancies and so forth?
Honorable Speaker, I think we need to stand together when we are addressing this issue. The government has a role to play. Communities have a role to play. Religious leaders have a role to play. Cultural leaders have a role to play. Young people themselves have a role to play. And that's why we need, such kind of gatherings and dialogues to all discuss and look at ourselves and see if we are each playing our roles to ensure that we prevent these negative, indicators that brought us today to discuss.
But then, Mr. Robert, policy-level actions remain hindered by socio-political opposition, mainly from religious leaders who actually aim to preserve good cultural morals. Don't you see this as a problem?
Honorable Speaker, this is very important. It's a very important topic that we need to discuss. We've done a lot of studies and a lot of engagement with religious leaders and different groups of people, and we have come to conclude that sometimes opposition to sexuality education results from lack of information. Some religious leaders actually do not understand into detail what sexuality education is about. And so this misunderstanding can lead to opposition that is unwarranted. Even parents, some of the parents don't understand, what it is about. And that's why we need to engage today and be able to share so that we know that it's not talking about sex. It's not talking about introducing young people, to sex or sexual activity, but rather it's talking about the process of growing up, the body changes, and how, these young people should handle themselves in order to avoid, the negative consequences of sexual activity, especially early sexual activity that is unguided by lack of information.
Of course, Mr. Robert Ochai, according to the Standing Strong Together project, which is being implemented by Reproductive Health Uganda, they highlight limited access to sexual reproductive health services as one of the challenges leading to this problem. Myths and misconceptions that are predominant in remote communities. What are some of those myths and misconceptions?
If a young person, drops into a health facility asking for a family planning method, for example, it is believed that young people are not sexually active, and therefore they have no business going into health facilities asking for family planning commodities. But practically, we know that some young people as young as 14, 13 are getting pregnant. And if they are getting pregnant, it means that they are actually sexually active.
At least 6 to 8%.
And then we need to not treat all children as homogeneous. We have children that come from different contexts. We have children, that come from slum areas. We have young people that come from, well-to-do areas. We have young people whose parents have challenges, and poverty is also biting. Therefore, I think we need, as government and communities and local governments, to put in place policies and also actions that address the needs of the different groups of children. We should not abandon all children into one bandwagon and assume that all children are homogeneous. They have all that they need for their well-being, and that we provide one package of information that fits all our children. One of the focus of this project, Standing Strong Together, is to have the voices of the public come up whenever there are issues that affect people in community.
All right.
Please feel free. This is a very open debate. Let us talk from our heart because we need to see a better future for our children.
Thank you very much, Robert.
Thank you.
All right, let me also take this opportune moment to invite the District Health Officer for Kabale to give us his own submission on the statistics on the same. Now, further to date, there is a draft adolescent health policy that is still being contested because of its lack of clarity on key issues to do with sexually active minors. You also have the National Sexuality Education Framework, which is still being contested by religious leaders because of some few issues. We also have a school health policy. You wouldn't believe it has been in draft form for 17 years. So we have policies, but lack of implementation or goodwill from the other stakeholders. So the DHO will give us some of the brief capitulations on the number of teenage pregnancies, early marriages, and so forth, limited access to sexual reproductive health services, and so forth within Kabale. DHO?
Thank you, Honorable Speaker of People's Parliament and members of this House. Abes Gensar Alfred is the name, and I coordinate health services in the Kabale district. So you are most welcome in this region. Yes, currently in this district, we have our from January up to this September last month, we have registered over 5,000 girls who have below 20 years who became pregnant, and this is quite a big number. 5,000. When you look at our teenage pregnancy rate in the district was really 14%. And 14% is, although it's lower, it's a national prevalence, but this is quite high. And this has also resulted into some teenage abortions, because from January up to September, we had 20 girls who are really aborted. We don't know the exact cause, but even they were young, and if you are young, you really, ideally you are supposed to be in school. But when you are not in school, you become pregnant. This is an intended pregnancy, and therefore, most likely you will be forced to conduct this criminal abortion, and this criminal abortion may result in 2 deaths. One of the challenges that we think is parenting. You have observed that most of these young people, parents don't talk to them about sexual reproductive health services. Some fear to discuss with them. Others, they have left them at home to be on the TVs. They watch any information they can come across. And some of the information is misleading and can affect them. Secondly, there is misconception about family planning for the young people. Culturally, here in Kigezi, when a young girl uses contraceptives, then they will say, no, why? You are not yet married. But we should agree that people can be sexually active. And if you are sexually active, there is no treatment that will stop this girl from becoming pregnant, because she's rarely moving out with men, and therefore there are higher chances of her becoming pregnant and even contracting other diseases like HIV and other sexually transmitted infections. So we feel that as parents, as religious leaders, and all of us, we should take up this. I know people will say, the religious leaders will tell me, but no. Why can't we promote maybe some behaviors that the church teaches? But sometimes it is very hard to know people who are engaging in sex, even those who are married, they don't go outside for sex, they hide. So if the people who are in marriage and they have that right to have sex, what about a young person who is already sexually active and is hiding with any person, and we are denying them to use family planning? Yes.
What interventions have you put in place to increase access to sexual reproductive health services within this area? Because if you look at 5,000, it's not quite big. It is very, very big number.
Thank you, Honorable Speaker. Of course, as sexual education, sexuality education cannot be a law of one sector. That we need multi-sector approach to address some of these issues. As a district, we have put in some interventions. We have organized advocacy meetings for the parents and for the young people, but this, the resources cannot be available because we need consistent provision of information to have behavior change that is consistent. Secondly, because if you want to provide a natural service, then you need a policy in place. We don't have the policies that really guide some of these interventions. Therefore, I call upon the government also to harmonize, some agree with other stakeholders, and come up with a sexuality policy that can guide our implementation.
We have three frameworks: the National Sexuality Education Framework, the Adolescent Health Policy, we have the School Health Policy, which are not being implemented. We have very, very many policies. So it means like implementation is the biggest problem. On your part, what have you done to implement these policies?
Thank you, Honorable Speaker. Of course, some of the policies are there and people are implementing. But I would also tell you that some challenges with the implementation of these policies. One, if you look at the financing of the health sector, if you look at the financing of the health sector and you look at resources available, you find we even don't have the better places to give services for these adolescents. Because we would want adolescent youth-friendly services. But you find you have one room, it's where you're going to see other patients. You don't have a private place for these adolescents. That's a big challenge. Secondly, when you look at the staffing in the health sector and you want to provide accurate services, then it becomes very hard that you have tailored services aiming at looking at this adolescent alone. Because you have maybe 2 health workers, you have mothers who are in labor, you have other patients whom you need to attend, then you end up bringing all the people at the same place. So these are some of the challenges that also need to be addressed. And when you also look at, when you want also to address, we need these girls to be in school. But you find the continuity of the students to be in school is also affected. You find a girl is dropping out in P5, P6. What can they do? Automatically they get married. And that's why I say from the beginning that the health sector cannot address this challenge alone. We need one another to address some of these challenges. And when you look at the poverty levels in this region, they are really very high. And health as a department cannot address poverty alone. We need agriculture sector so that people, they have what to eat, they can support their girls to be in school, and therefore they can support our interventions, not allowing a girl to move to school without even pads. What will she do if she's menstruating? Meaning that if she's going to school and she meets someone and says, no, today I will give you what to eat, then she's going to give in, and finally she'll be pregnant. So
you're talking about the problem that government resolved to work out, which is to avail sanitary pads to all school-going children.
Yes.
How far with that?
I think we are still very far as a country that some of these things are not yet in place. I don't know whether we have started giving pads to girls. This is what the government has promised. But I think that's why I feel with this parliament, we should come up with workable solutions that parents can do, the adolescents can also do. Then, because on our part, as health department, we really guide and we can provide whatever is available to ensure that our girls have the better lifestyle in schools, and they get married at the right time. They don't undergo this stressful event.
But also help us understand, is it true that there is a lack of goodwill to implement these policies, especially from religious leaders?
There is some goodwill from religious leaders, I would say. But of course, they have their own issues they want the government first to address. And some of them, they are looking at, why do we teach girls on sexuality when they are still young? Then the religious leaders need to know that the government should come up and highlight why we should have sexuality education. Because others are saying, why should we give family planning to these young people? And that is a concern of the religious leaders. So we feel we need to bring them on board. They understand that although the government is trying to look at sexuality education, provision of information for behavioral change, for someone to undertake a certain behavior, then this person must be empowered with information. And we should start with information before we even move to provision of family planning, provision of other things that have been raised by religious leaders. But I'm very sure they really support this.
Thank you very much, Mr. Albert. He is the District Health Officer for Kabale District. Thank you very much for your humble submission.
Thank you.
And of course, we shall take a short break, but when we do return, we anticipate to hear from the District Community Development Officer, because Mr. Albert, the DHO, mentioned something about poverty exacerbating this problem. So what is the District Community Development Officer doing? What are some of the interventions they've put in place to reduce the poverty levels that are increasing this major problem? We'll take a break and be right back. Welcome back, and many thanks for staying with us on the People's Parliament. We are streaming live from the Kabale District Headquarters, where we are actually exploring the role of the policymakers in the promotion of sexuality education and sexual reproductive health and rights services, respectively. At this opportune moment, we are going to hear the submission of the District Chief Administrative Officer, that is Mr. Ntimba Edmond. Mr. Ntimba Edmond, take over the floor.
My name is Ntimba Edmond, as already introduced. This topic is dear to us because among our priorities, as the district planner there will extrapolate later on, that we have one of our priorities is to prioritize health in terms of reproductive health activities, actually family planning activities in the district. And every year we devote some money, though it is little money, but we try to put health related issues in terms of reproductive health, because it is very important to achieve a national goal of having a quality population, quality and productive population. So you are very much welcome. Our girls in Kabale were not allowed to get pregnant out of wedlock. They were supposed to mature into adult women, get married at a certain time, and married officially in their tradition. To an extent,
so what changed?
To an extent that in Lake Bunyonyi, we have an island called Kampene Island, where these girls that get pregnant when not mature would be isolated and put, but that also provided a safety vent for these poor men who didn't have a bride worth to pay. They would go there and pick that girl that was thrown away. Or to emphasize that there should be respect for sex and nobody should. But in this COVID environment and this education and exposure aspect, things came to be messed up. You find young girls, teens getting pregnant. This COVID, as the health officer has elaborated, has increased the situation in that aspect. So the government of Uganda has come up with a policy regarding guiding children that are out there in the home, and they want at one other time to be given chances of maturing in education. So now there is a guideline in education that these girls, they should be given chances to continue in education. So no headmaster, no school governing body should expel. And that word, I was very, it is very violent. Expulsion, expel, that is to eject. So these girls are not supposed to be ejected from school because it is not their own making. They have found themselves in a situation where, out of circumstances, they ignorantly fell into that kind of circumstances because they are brought away from the formal education system. The parents are at loss with these young girls and boys, and let's not emphasize the girls only. The boys are all equally affected. They are the ones, some of them, impregnating these fellow children of theirs. So the aim of this meeting is for you to debate freely and give out the Kabale experience. How are we coping up in this COVID situation?
But thank you very much for your humble submission. Mr. Timber Edmond is the Chief Administrative Officer for Kabale District. Thank you very much.
Welcome to the People's Parliament in Kabale.
And
may I take this opportunity also to introduce you my leader, who at another time will come in, and the Vice Chairperson, Madame Bridget, she's here with us, and this is to show the commitment of us, Kabale, to welcome this project.
Ladies and gentlemen, the cow of Kabale District, Edmond Ntimba. And at this opportune moment, we are going to open this August's House floor to the members of the public. I'll start with Mr. Justus Tindiebwa. What are your queries on this issue? Please come over. And if you also have a query in this August House, you shall be raising your hand. I shall be picking you at random.
Thank you very much. I have already been introduced, and I would like to say that professionally, I am a journalist by training, and also I do some voluntary work as a member of Reproductive Health Uganda. I sit on the branch executive committee of Kabale. Now, since this debate started this morning, there is something that has cropped up, Honorable Speaker. You have said some various policies that intended to address challenges of the young people as they grow and that as they experience body changes in their bodies that have been in abeyance, they have been stayed. Now, the question that comes to mind is this: what type of information was contained in those policies? Is there a fact that the government of Uganda or the Kabale District local government does not have the goodwill to implement? I want to propose strongly that provision of very relevant information that addresses the needs of these adolescents should be put in place. I get the impression that actually out there at the grassroots level among the people, maybe people are ignorant about the need for provision of this information. I have not had any research conducted, but I don't see why, if, for instance, we have experienced teenage pregnancies, like the district health officer was saying here, rising numbers. I don't know why that has happened, because the role of government, any government, is provide pertinent information to address challenges in health sector or anywhere. So I like to propose, Honorable Speaker of Parliament, that provision of relevant information to address this challenging problem of adolescents' reproductive health issues should be put in place. There is need, first of all, to have a media policy. There should be a media policy that is well thought through, and there are very many media channels. We have the print media, we have the radio media, we have the pictorial, we have the TV like you are here. But I think importantly also, the media should be brought on board. through sensitizing them so that you can win them over to be able to participate, to own this communication policy and actually love doing it for the benefit of
the media can do its part, but then the biggest problem is proliferation. Because how many people own radios? How many people own TVs? Even if we send the message, how many people are receiving it? We can send the message, but what is government doing to avail the radios, the TV sets to these members of the community? Go ahead.
Okay, fine. That's a very good, Mr. Honorable Speaker, that's a very good observation. But you see, for instance, in the rural Uganda, as I said, the majority of the people, irrespective of whether they know English or not, they can access information through radio communication. Yeah, that's a challenge, but you see, when somebody was contributing here, he observed that there is poverty, there is rampant poverty. Government also at the same time should put in place policies that are going to bring people out of poverty.
Justice Ndewa, a veteran journalist, please, thank you very much for your humble submission. We still have more time for you members of the audience to make your submissions. Your name and your submission.
Mr. Speaker, my name is Alinda Nsheka Wilfred.
Alinda.
I'm born from Rwanda district in our neighborhood. I'm happy to be here today. I'm very much concerned about the number that the DHO raised, saying at least 5,000 girls, teenage girls, actually became pregnant. My focus on this regard is government's reaction after those teenage girls became pregnant. It is something that was reported in the media, and we have not seen government come out to really show maybe it's concerned. Of course, several years ago, we saw government bring up policies to protect the teenage girls. There is a Penal Code Act of 2007. That act criminalizes having sexual intercourse with girls under the age of 18. It's criminal and it can attract death or life sentence. In this regard, I would say maybe we expect more than 500 boys being imprisoned for life. But where are they now? Where are those 5,000 boys? Where are they? Maybe we can say there is some laxity. Government is not coming out to really show that it supports the Penal Code Act of 2007.
So government has been complacent.
Absolutely.
Your next query and final query, Ali.
And it's not enough, by the way. We have the National Adolescent Reproductive Health Policy of 2004. That policy, it was put up by government in 2004 to really tell the adolescents their rights to access sexual reproductive health knowledge.
So your biggest problem is
on government. It is not enough. You have the Uganda National Development Plan of 2010 to 2014.
And finally,
government admitted that it's true, teenage girls really have this, they have got a problem. They need to be helped. But we have not seen government come out. My idea was, much as we raise and speak, much as we speak about what needs to be done, much as we criticize the religious leaders, we need to find to forge a way how we can force government to really put up these policies. Otherwise, we shall speak, but government is to act.
We do have 3 minutes for each member of the audience to speak, and I really wish that you exhaust your pointers within those 2 or 3 minutes. Hello there. Your name and your humble submission.
Thank you, Mr. Speaker. I'm Humza Monica. I'm a Senior Probation and Social Welfare Officer for Kabale District. I hail from a background where teenage pregnancies, child marriages, sexual abuse, especially on children, is very rampant. I share a lot with the DHO's office in terms of service delivery for the children.
So as a social welfare worker, what are some of your discoveries?
They are quite appalling.
Please go ahead.
If I may just zero to the lockdown period, my office, in conjunction with police and the DHO's office, specifically we look at over 1,000 teenage pregnancies, and we have assisted girls right from our offices for referral to the health facilities with attempted abortions, really coming, almost failing to walk, seeking help from our offices. It is quite challenging. And when we just throw back like 2 years, 2018, we were able to identify 91 teenage pregnancies, specifically from primary schools. And still in the previous 2 years, we got 2 13-year-olds being pregnant. They were assisted to deliver at the age of 13. And the two, of course, went through the justice system. We are glad that justice has prevailed, but that was really so dangerous and risky for these girls to deliver at the age of 13. And when it comes to child marriages, I'm not comfortable with my community, because by the age of 17, by the age of 16, a girl is looked and seen to be very mature, and yet they remain children. So we have a lot of child marriages here in Kabale.
Exacerbated by members of the community.
To me, yes, because it is a role of the community to protect their own children. It is a role of the community, of the parents, to do good parenting and raise their children very well. And when they don't do it, the blame comes back to government. Government is us, it's we. The child begins with us at home. And so, Mr. Speaker and members, I would wish to see parents move a step further and take their roles. Actually, personally, and as a government officer, I embrace the sexuality education.
Thank you very much, Monica, for your humble submission. Of course, before we get our next speaker, let's take a very short break. We'll be right back right here on the People's Parliament. Do not go anywhere. Yes, we shall return shortly. Welcome back to the People's Parliament. We are still camped at the Kabale District Headquarters, where we are exploring the role of the policymakers and other educators in the promotion of sexuality education and other sexual reproductive health and rights services, respectively. My name is Romeo Busiku, and of course, I'm your speaker for this August House. And we are still open to the members of the public. Let's hear it from that gentleman right there. What is your humble submission? Only 2 to 3 minutes.
Right Honorable Speaker, my name is Anamara Christophe, District Community Development Officer. Honorable Speaker and members, when the DHO was presenting the statistics of over 5,000 people getting pregnant, I have been puzzled and asking myself, we have been in a confinement, children staying with their parents at home, without moving or visiting relatives. Who made those girls pregnant? Their brothers, houseboys, or their fathers? 2, since we were in lockdown, why did they engage in unprotected sex? Was it because the health facilities were not functional? Those are the 2 questions I have been asking myself alone. And from this People's Parliament, I expect answers from them.
Let's hear it from the lady. 2 to 3 minutes. And then one final person. You'll be the last.
Thank you, Mr. Speaker, sir. May I speak on behalf of the young people? I'm Catherine Chomjisha, the Education Officer in charge of guidance and counseling. Mr. Speaker, the young people need space. They don't have space. The young people do not have space in their own homes, in our health facilities, as we've seen. When children were at school, teenage pregnancies were a little bit low, and when they are at home, they increased. That means we lack parenting. As parents, we are not doing our role. We left all the other roles to teachers. Mr. Speaker, the young people need sexual reproductive health commodities. Where are these commodities? Can a young person like a P6 chap or a student of senior 2 access like a backup pill? Can she afford? Where are these commodities to help these young people?
Does she even know there's a backup pill that can help her? Those are some of the questions. Yes, Catherine.
I'm not sure. Some know, others do not know. But for the case of space, if a young person goes to a health facility, there is this big queue. Your mother is in the line, your father is in the line for different services, and for you, you've gone for sexual productive health services. Where will you start from? Mr. Speaker, we need space in our health facilities. We need staff. We need health staff in our facilities. And I appeal that this vice teenage pregnancies and early marriages, we need a holistic approach. Religious leaders, we need you to help us, because most of the religious leaders I've interacted with, they say, yes, there is sexuality education, but where is the package? What is packaged in that sexuality education policy that you're giving to my child? So parents need to know what we are going to share with their children, and they embrace these policies. Unless they are educated and they know what is going to be shared to my child in P4, in P5, in senior 3, these policies will keep in place and they will not be working. Mr. Speaker, that teenage pregnancies, they have caused loss of lives. Many girls have lost their lives and boys are there enjoying their lives. It hurts me. It is painful. So the girls should be given space. If it is family planning, let them access, but well guided.
So Catherine mentions that we need more space in the hospitals from the teenagers. They cannot be
Thank
making
you,
lines
Mr. Speaker,
with their
sir.
mother.
I'm Tumhirwe Florence. I'm the Executive Director of Kigezi Women in Development. All the way, I want to first share my experience as a community reproductive health worker with Care CREP all the way 1994.
You can do that in 2 minutes, it's okay.
Yes, I've shared a lot with the parents, whereby when we talk about talking with children, they will tell you, how do you talk about with children about sexuality and growing up? And yet, they are not supposed to know the information regarding sex until they are old enough to get sex when they are married. But I want to talk to parents and tell them that these children are sexually active. The fact that they get pregnant is enough that to tell us that they are sexually active. When we look at these figures of 500 plus teenage pregnancies in just a period of 9 months, it's alarming and it is hurting. I want to talk about the issue when the cow said that there is a guideline allowing girls, pregnant girls, to return to school. It comes with a cost. And again, when these children are at school, there is a stigma. Even when she gives birth, what does she do? She's a child. She has nothing to buy. Even when you go to the maternity ward, they will ask you for a kit. Where are the things where you are going to put the child? Those children don't earn money anywhere, so they will not even have the things to care for the children. They are also children. It is hard for a child to care for another child. When we look at the health officer, he talked about the spaces and the staffing. We have been engaged in the health system advocacy partnership project, where we find that when we even the health facilities that put in place these youth-friendly corners, they lack the people who have the skills to care, to talk to children, to the young people. They even lack the spaces where to put these young-friendly services, where they need to have like a TV set, like even indoor games, so that when the child is going to attend to those services, they don't need to ask him, where are you going, or where are you going if she's a girl, because we see we are not sick. But when there is that friendly corner in the facility, they will know that all the teenage girls and boys go there for those services. Then I want to come up with some interventions. Can government fulfill its promises? We are signatory to the Abuja Declaration, where health financing should be at least 15%. But we are always at 6.5.28 there. This is the reason why the health facilities are not staffed up to 100%. And even Uganda, they passed this law of saying that health should be financing, should have all the staffing levels at 100%. But you ask the Kabale district, we are at 72. Now, if we are missing these cadres who are supposed to have the skills to care for the young people, and yet Uganda is one of the youngest nations in this world. So look at Uganda without planning for the adolescents and the young people who are the future leaders of our nation.
Thank you very much for that humble submission. And with that, we've come to the end of this edition of the People's Parliament. Of course, we were streaming live from the Kabale District Headquarters. But in the interest of trying to exhaust all the pointers with regards to the sexual reproductive health and rights challenges, we shall actually proceed with this conversation next Saturday. So as you go to your beds tonight, just remember, 68% of the young girls have sex before the age of 18 and 62% of the young boys in this country have sex before the age of 18. My name is Romeo Busiku, your speaker. We shall return to Kabale next Saturday. Good night.